be showing you some lingual strengthening and range of motion exercises. I'm going to start with a lingual exercise. These are appropriate for patients that have had a stroke, have had or neck cancer, or have received tongue surgery. Resistance exercises to strengthen the tongue has the most evidence to support its effectiveness. Today, I'm going to be using a modified Iowa Oral Performance Instrument, or IOPI, to show you how to build lingual strength. To perform this isometric exercise, you can use an IOPI. If you don't have one handy, you can use a low-tech device like a spoon or a tongue depressor. In today's demonstration, we're going to be using a modified IOPI. So Sarah's going to demonstrate how to use this device. She's going to place it in her mouth, and she's going to use her tongue. She's going to close her lips around it, and then she's going to press her tongue against the roof of her mouth, and she's going to hold it there for 10 seconds. And after she's held it for 10 seconds, she's going to do that 10 times in a row. The protocol for this is very well laid out. She's going to do this 10 reps for 10, holding for 10 seconds each. She's going to do this 3 times a day, 3 days a week, over the course of 8 weeks.
Next, we will discuss range of motion exercises being used in clinical practice. Range of motion exercises are important for the flexibility and dexterity of the tongue. This is important so that the tongue can manipulate and contain the bolus. You want the tongue to be able to keep the bolus within the center of the oral cavity and keep it from falling into the sulci. You also want the tongue to be able to move around freely to mix the bolus with saliva. So, range of motion exercises are good for patients who have lost their range of motion dexterity due to strokes, radiation, or have had tongue surgery. Alright, I'm now going to go over the instructions of how to use range of motion exercises that are being used in clinical practice. Corinne is going to demonstrate as I tell her what to do. First, stick out your tongue as far as you can and hold it for 5 seconds. Move your tongue upward towards your nose and hold for 5 seconds. Move your tongue down toward your chin and hold for 5 seconds. Move your tongue to the left side and hold for 5 seconds. Move your tongue to the right side and hold for 5 seconds. And then I would have her repeat this for 5 to 10 times.
Right now, IOPI is the most heavily researched lingual exercise approach, but more research is needed to solidify its effectiveness. Studies for IOPI suggest that it may be effective to increase muscle mass and to help with anterior to posterior movements. Currently, more research needs to be done examining its effectiveness to help patients maintain their bolus to help them propel that bolus towards the esophagus. The reason why it's favored compared to other exercises is because it gives quantitative data to mark its resistance in the oral cavity.
Oral motor exercises are believed to improve the safety and efficacy of swallowing function in dysphagia patients, and they are widely used in the profession of speech-language pathology. However, the evidence is inconclusive and insufficient to determine the effectiveness of this treatment. More specifically, there is even less research to support the use of range of motion exercises. Specific protocol has not yet determined the intensity, frequency, and type of the oral motor exercises. Therefore, the research cannot conclude whether or not this is an effective treatment.